Hi, welcome to Flowers Medical Flowers Medical Group. We're doing our Facebook Live event here this week. This week we're going to talk about advanced cardiovascular testing. We are partnered with a group called Boston Heart Diagnostics, and so we're pleased to have Dr. Michael Dansinger. He's the medical director for Boston Heart to talk about some of the advanced testing, some of the science behind that, and some of the tools that come with that we can help to employ with the patients to help reduce their cardiovascular risk. Welcome.
I'm pleased to be here. Thanks for the opportunity.
Awesome. So tell us a little bit about maybe the background of Boston Heart and some of the diagnostics that they do and why we would do advanced testing like that.
Sure. So I'm the medical director at Boston Heart and the director of the lifestyle program. And Boston Heart originates in academia. The purpose of Boston Heart is to bring specialized insights, innovations that came out of Tufts University many years ago, to bring those to medical doctors and their patients. It's specialized testing that allows clinicians to see more clearly what's going on with the patient's risk of heart disease.
And so is there a particular group of patients that we're targeting with that, or is this something that really everyone should have a look at to know their risk factor?
So these are special tests. They're not for everyone, but very many patients can benefit from this testing. Patients who have risk factors for heart disease. Perhaps they have heart disease itself, or diabetes, or pre-diabetes, or high blood pressure, or cholesterol abnormalities, or inflammation in their arteries. There's many reasons why certain patients could benefit from this specialized blood testing.
And so we take that and we use this in our patients here at Flowers Medical Group. It gives us some detailed information about putting the fuller picture and maybe even discovering some unknown risk. Because many times we talk about you can't feel your cholesterol level. Sometimes you don't even feel inflammation, and we have to be aware of that so that we can create a program. When we're looking at that, of course, our approach would be to do a more integrative medicine approach, which actually dovetails very nicely in the Boston Heart program for the lifestyle medicine. So tell us a little bit about some of our tools that we use for that from Boston Heart.
Yeah, absolutely. So many patients have hidden risk of heart disease that are visible as a result of the specialized blood testing. Can I give some examples of some of the key tests that I think are the most important? So many people know that cholesterol is important, but it's not enough just to look at the total cholesterol level. We know that there's good cholesterol and bad cholesterol, but in recent years, we know that not all of the bad cholesterol is the same, and we know that not all of the good cholesterol is the same. So for example, for a patient who has high levels of the bad LDL cholesterol, it's useful to know where that high cholesterol is coming from. So we have a special test, the cholesterol balance test, that can help give the doctor insight about whether the patient is absorbing too much cholesterol from the food and from the intestinal tract, or whether that's coming from the liver, and that allows the doctor to treat the patient as a specific individual. Another example of the testing is to improve the HDL reverse cholesterol transport. That's where the body is cleaning the arteries using the good cholesterol, but not every patient's good cholesterol is working properly, and so we have a special test called the HDL map that allows the doctor to see abnormalities that would otherwise be invisible and treat that accordingly. So we have several other tests that together give the doctors a full picture of the patient's true risk factors, and I think that's why you've been using Boston Heart for your patients.
Right, and looking at some of the key factors help us to design the program. And of course, we're using an integrative medicine approach to avoid medicines, but even if the conventional medicine could look at these tests, it also is designed to help drive what are going to be the most effective medications for each of those based on the test. One of the things you mentioned too is the combination of looking at the cardiometabolic risk, blood sugar metabolism, very important, insulin, also inflammation, oxidation. So it's what's happening to the blood vessels, to the cholesterol itself that helps us to define that. And one of the inflammatory markers in that we look at is something called LP-PLA2. So that's a very important one that can also even give us an idea of near-term risk And really, that's a very specific marker for vascular inflammation. So we can be more targeted and more aggressive in certain areas, and then not so aggressive in the areas that there's not such a high risk marker.
Oh, I agree completely. As you mentioned before, some patients, their arteries are almost like on fire, but you can't feel that fire, but you can see it in the blood testing. And when you know that fire is there and you know how to put that out with the right lifestyle changes and with the right supplements or medications, together you can manage that inflammation, put that fire out, and then you can see it in the blood tests that go from the red coloring on the test to the green coloring on the test. I love the way you manage the patients to get them out of the red into the green.
There's something very satisfying about seeing that. That's one of the tools that Boston Heart provides, is the format in which this is displayed, so we can go over this in a meaningful way that's understandable, because this is really complex medicine. The underlying science is very complex, and so the challenge is making it into an understandable model that's also specific to each individual patient. So each individual patient gets their own set of labs that's in the educational materials that really explain along with their individual personal risk, and then also go along with our treatment plan. So we design things that are very specific to them. So each person may not have exactly the same plan, just based on what their markers are. One of the other important things that Boston Heart does is the specialized genetic markers just related to cardiovascular risk. Can you talk a little bit about that?
Oh yes, certain individuals have increased genetic risk, and certain individuals have a high level of a genetically determined cholesterol called Lp(a), and that can run in families, and a patient could have relatives who've had premature heart disease or premature death from heart disease, and that genetically determined Lp(a) can be seen on the blood testing. And when you know that's there, you want to make sure you do everything in your power as a doctor and a patient to control the things that you can control. Another genetic test helps doctors with patients who are at risk for side effects from statin medications, like Lipitor and rosuvastatin. And so patients who take those cholesterol-lowering medications are often concerned about the side effects like muscle aches, and using the genetic test to look for risk for what we call the statin myopathy, you can manage that in advance rather than waiting for side effects to occur. So, and then there's other genetic tests that we do as well.
Yeah, no, I think that's very important, and that's actually one of the tests that's unique to Boston Heart right now, and is available to look at to help us to, again, individualize our care for them. Anything on the horizon for Boston Heart that we should be looking for in the future?
Well, I'm most excited about our lifestyle program. So our lifestyle program, because heart disease is primarily a lifestyle disease, and about 80% of the heart disease that we see is potentially preventable through lifestyle change and healthy eating. Our lifestyle program just keeps getting better and better all the time. And our area of specialty and expertise is creating personalized, individualized lifestyle plans, eating and nutrition plans for patients. And so we have something called a life plan, which is now available to more and more patients. Any patient who has Boston Heart testing is eligible for our lifestyle program, and our ability to personalize that will just get better and better in the future.
That's awesome. So this is a great example of some of the advanced techniques and technologies that we're using here at Flowers Medical Group to do personalized, individualized medicine, and encompass all of the things that help to make you healthy and achieve what we call performance health. Thanks a lot for being with us, and look forward to seeing you on our next Facebook Live.